So, good evening, all who have joined today for today's podcast. Today, amongst us, we have Dr. Nidhi Yadav, advocate, who is advocate by profession, but she has done MBBS as well. She is going to speak on uh, doctor-patient relationship, a medical outlook. Before that, let me introduce our president, Dr. Sunita Tandulwadkar, madam. She's a dynamic, vibrant, proactive leader with innovative
Alka,
ideas. Yeah.
Alka, it is your day with Dr. Nidhi. So,
Yes, that's one line. Recently, she got awarded with honorary fellowship, honoris causa, with the Royal College of Obstetrician and Gynecologists on 11 September. Madam, we all have witnessed the program. It was very wonderful. And of course, proud moment for you and of course, we are Foxians. So with this, because you are not allowing me to read the CV,
no,
so this is
Alka, it is
short
so
intro.
important for you to have a beautiful dialogue. Thank you
Yeah.
so much, Alka. You always do amazing work, and it's your passion in the subject that you come out with the different ideas. Today, you chosen Dr. Nidhi Yadav. Welcome, ma'am. I
Thank
join always for just to welcome you all for giving the time to Foxy. This Gyan Pravah series happen every day at 8 p.m. And Alka, today is which number? 200 and
220. 220.
fantastic. 220th episode. It is going on. My supporting team from Evangel and my committee chairperson, they are doing excellent job. And every dialogue which they have with their faculty is amount, it attracts the national and international equally. So thank you so much for coming, and you can introduce Nidhi, Alka.
Yeah. Dr. Nidhi Yadav, she is an advocate. At the same time, she has done MBBS, LLB, PGD MLE from Bangalore. And she's an expert in medical law. She's a medical legal advisor. Previously, she was attached to Medanta Group of Hospitals for 1 year. Now she has her own firm, Medi Justice, of which she is a managing partner. She is an advocate specialized in health law and practicing criminal, civil, and RERA laws in Delhi NCR, presenting for hospitals and doctors before various consumer fora in Gurgaon and Delhi, High Court, Supreme Court to safeguard their reputation and defend them. So she is a doctor-friendly advocate. She is a medical law advisor to various hospitals and nursing homes in Delhi NCR. She is a teaching faculty at Lloyd Law College, educating upcoming law students about health law. So she is expert in health law. She is an external member of POSH internal committee in various hospitals and companies. She is vice president, that is advocate wing of Indian Medical Legal and Ethics Association, and board member of JIMLIA, that is the Journal of India. She's a faculty and speaker at international conference organized by IMLIA specially. She was a medical legal consultant at Medanta Hospital. And now I remember her Haryana project with Haryana OBGY, Abhilasha project. And second one, Udan project for adolescent health with Haryana again. So these are the special projects. I think Dr. Nidhi, you had participated in the past. And the important thing I would like to tell you, Sunita madam and our audience, that she has done residency post in cardiology, OBGYN and gastroenterology. And after that, she went to this,
I
selected some
can
different.
see, I can
Yeah,
see all the law books behind her.
yeah.
So that's wonderful, Nidhi. But
Thank you.
I'm so glad that you have done MBBS and then entered into law. So definitely you will be from seeing everything from a different angle than just the lawyer. So I'm glad that you have entered in a better community, chosen Delhi. So you will be in a better position financially also than in a medical profession. So fantastic. And thank you for coming. And definitely, I would like to meet you sometimes. Definitely.
It would be my pleasure, ma'am. Thank you. Thank you for the kind words, ma'am, Alka ma'am, and Sunita ma'am. It has definitely been, I'm loving this profession. I wouldn't deny that. And it is my pleasure to have, it is my honor to be in both the professions, and having, knowing the nuances of both the professions. I think to amalgamate it, even at the level of Supreme Court, it just gives me joy. So I think that's the best thing that I could do.
Thank you. Lovely
Yeah.
meeting you.
Thank you.
And
ma'am.
I
Same to you.
Enjoy your podcast, and I joined the viewers link to listen to both of you. Thank you.
Thank you.
Thank you, Dr. Sunita. Thank you for that. So let us begin with our podcast, Dr. Nidhi. So before I start my first question, the first question whether I would like to ask you, because you introduced just now because you are interested in medicine. So you passed MBBS, and after that you had postgraduate post, SR post rather, residency post in gynecology, very difficult subject, again gastroenterology and cardiology. After that, you selected this legal line, rather, your profession. What made you to change this after having passed MBBS?
So, ma'am, there's a little story about it. Law was never a foreign entity to me. So I grew up listening to legal terms because my father is in this profession since almost like 40 years now. So when I was always keen to pursue law, but my dad told me कि law तो कभी भी कर सकते हैं, MBBS नहीं कर पाएंगे, अभी admission मिल रहा है तो admission ले लो. Because at the same time I could do law also. I cleared few entrances for the law as well, and the same time MBBS as well. So he said that do law later if you want to, because around us everyone's lawyer. There were no doctors in the family. So I heard, I listened to him, I followed his guidance. And once I did my MBBS, I was doing house job with Dr. Ragini Agrawal as her associate. So she told me that why, so I just expressed my feelings that I was interested in doing law. And she was like, you should do. We do need someone who can understand both the aspects. And I think you can create a niche in the field. And you know this and you know that, and how many people do follow this passionately. We do need a passionate advocate, so that now with upgrowing litigation, upcoming difficulties in this profession, we do need someone to stand in the court and then say what we want to say, because it is very difficult for an advocate who's not a doctor to convey what doctor wants to say in the court of law. So, and then I took that very seriously, and I pursued law, and here I am, and very happy about this.
Yeah, actually, that time it was very difficult to get admission in MBBS medical college as compared to law college. But now today is the need of the hour is legal knowledge, because just because we have MBBS or PG, it's not sufficient for us. Also, we must have minimum laws that govern our knowledge about the laws that govern our day-to-day practice. So a friend like you who always help doctor, they're like, so we must have friendship with such a person who is always there for the doctors to defend their case in the court of law. Because that time he is in so much dilemma, what to do, what not to do. So
Absolutely.
nice thing about it. Yeah. And second thing, you got some motivator that help you to select another line, because that's this challenge. After passing MBBS, after doing a residency post in 3 special branches, then you selected the legal part of your profession as a profession. So this is wonderful for you, and that made a change, I think, your life, total life also.
Yes.
Because you advice, or you can give some expert advice whenever a doctor comes to you, your hospital, your help, legal aid. That definitely is a friend in need, actually.
Yes.
You are going to speak on, rather, we are going to interrogate on subject doctor-patient relationship, a medical outlook. We know when we started our practice, even before that, doctor was like a god for the patients. And after that, because of the application of Consumer Protection Act, the relationship got changed. So the relationship which was of trust and transparency, because of application of CPA to our medical profession, got changed into transformed into buyer and seller relationship. So actually, what is mean by doctor-patient relationship? Why it is changed in the present era?
So, very categorically speaking, ma'am, doctor-patient relationship to begin with is just a consensual relationship between a doctor who is, or I would say, a relation between a patient who's knowingly seeking a physician's assistance or a doctor's assistance. And at the same time, this doctor is also accepting this person as a patient. This is a very simple, I would say, a doctor-patient relationship. Now there is so many elements to it, which makes it just not a simple relationship. Just because there are two people, that does not mean a relationship can be simple. Right? So two people, the doctor amongst these two people, doctor has sits in a pedestal where this doctor is nowadays, sadly, not sadly, is providing service to this patient, because we are in CPA, as you said. So now this doctor has an obligation to give a standard of treatment to this patient, respect this patient's autonomy, take informed consent from the patient, and always provide treatment options, like what, and then, helping patient to reach an informed decision. So there are so many things to do. Even the patient, a doctor cannot even abandon the patient immediately. The patient, the doctor has to be loyal to his patient. So I would categorize this into 4 elements. Say one is knowledge, where the doctor has a knowledge about his patient, and the patient has a knowledge about his doctor. Then I would say then there is a trust, faith, belief between these two people, which is also a key element to this relationship. Then there is loyalty that the patient has towards should have towards the doctor, that whatever the treatment is given to the patient follows it, and the doctor also has a loyalty that the doctor would also not abandon the patient without giving any prior intimation or a solid reason, I would say, in a layman term. And the last, I would say, another element is regard, like how much a patient is paying regard to the doctor, and the doctor is also paying regard to the patient. Like a patient should not think that this doctor is not towards it's not on my side. He's just doing what he needs to do. So that mentality should not come in. Having said that, the doctor-patient relationship also used to have this paternalistic approach, which we also say active-passive model, where a doctor used to just tell the patient that this is what I'm doing, you just need to follow it. So the patient would not have any option. So now I wouldn't say that this is an obsolete model, but it is under practice.
Dictator-like, do this, do that.
But this is still in practice only in emergency situations. So it is not yet obsolete, because there you don't need, as a doctor, that is the only exception where a doctor does not need to respect patient's autonomy. Say if the patient is unconscious, so it is the primary duty of the doctor to save this patient. Now we are at this approach where we have to take an informed consent. We have to just explain everything to the patient and let the patient reach the decision. So this is another part of a doctor-patient relationship where both of them are going to reach with the consensus to a treatment option and respect each other in that way. So communication is the key now.
Yes.
Now, where are we reaching with this communication? We are reaching basically to the patient satisfaction, so that the legal problems are less.
Does not arise.
So when we reach a patient satisfaction, what is patient satisfaction? So it is basically a degree to which this person who's being provided this medical service is coming to a conclusion where he can say that I am being whatever the service are being provided to me are useful, effective, and beneficial to me. So this is what patient satisfaction. This is the goal of a good doctor-patient relationship.
Yes. Actually, what you had discussed exactly, because when my grandfather was practicing medicine, that time the patients just used to listen to what doctor is saying without a single word, take the medicine and go back. But now I have to explain everything to the patient. She accepts whatever I told her. Then she decides which way is better for her. Then we have to start the treatment. So this is the informed choice to the patient. And that builds a trust and transparency between doctor and post patient. But now again, there are the things you just so you explain how it should be. Should be transparent, understanding should be there, respect each other's opinion, except in emergency, because that time autonomy is not important. Saving the life of the patient is important. But now with the application of CPA, it has become as if doctor is not human being also. So don't consider doctor as a god. They used to say next to God, semi-God. But now the people have started, even if something happens, it was not expected, some mishap or some unexpected outcome, they start some violence or damage the property of the hospital, even manhandle the person. So all these things, I think there is some change in doctor and patient relationship. So what are the factors you think as an advocate that made this change?
So, this is how I would answer this, ma'am. So, as you said, back then, a patient used to respect doctors, and the doctor would rather have the autonomy than the patient, right? Now, what has happened is we all know that doctor-patient ratio is very bad in our country. Now, their doctors are very less, and if you go to any public sector hospital, government hospital, or a corporate hospital, they all are burdened with the patients, right? And corporate hospital is basically a business. This is how I see it. It is basically, there are few hospitals which are run by non-doctors, right? So now these two things are linked, because they, like how I am thinking and how any other patient would think, they are basically a business model for someone who has actually constructed that business model. And now this perception is being out there in the world. Now the doctor sitting inside this business are the doctors, are simple doctors who are just there available to patients to treat them. But to have this profit running hospital going, there's this load that has the patient number of patients that are accepted by the hospital, they are not getting less in number. So now these hospitals are overburdened, and the doctors sitting inside these hospitals, they want to close their OPD at 4, but now they have these 20 more patients waiting. So how do we expect them to see those 20 more? So he sits in the morning and says that, okay, I cannot give more than 5 minutes to a patient, because every day in the end, I have to stretch my day to probably the OPD to 8 p.m. So now this is overburdening. So the key of communication is time. You have to give time. More time you give to the patient would be, as I said, the goal is to reach patient satisfaction. There's no satisfaction, because the moment the patient gets out of your room, he's like, I am not satisfied. He didn't explain properly. He didn't explain even the medicines. He said, bahar jaake pooch lena. Maine likh diya hai. You know, so where are we reaching with this? Not a satisfied patient, and they will definitely be turned into some probable litigation in, further in the course of time. So then also, now coming to public perception back again. Public is now aware these days. They can think of loss, gain, good, bad, everyone. Gone are those days when people were not very educated, didn't have access to internet, could not know what a medicine is for, right? So, and what the hospital is doing. These big buildings are not built for free. To be specific, I'm not saying that the big hospitals are bad. They are the best thing that can happen to the mankind in India. Because if we don't have this infrastructure where we have multiple machines, highly qualified doctors at one place, you go and you have all the medical facility which are not even in US. Yes. Yeah. And that promptness, ma'am, that matters, right? The quality could be better in US, as people say, and I'm not saying that, but as people say, the quality may be better in US, but then they have to wait in ER for hours. So I think these corporate hospitals are definitely the best thing that could have happened. But at the same time, there is another angle to which every common man is looking at. So this is changing their perception, the entire public perception that these are profit-making businesses. And then ये private practice में कहा जाता है किसी से पैसा निकालना सबसे महाभारत वाला काम है. कोई patient पैसा देके, and these big hospitals, when they bill you out, and when you see the bill, you get crazy. You are like, a patient gets crazy. Patient's like, nahi, itna kaise bill aa sakta hai? You must have done some extra tests, and because the doctor did not have time to communicate well, Now this patient in the end is definitely going to doubt. There is no other way to set his emotions down. The blame game starts then. So this is also one of the reasons. Then the misinformation and the unrealistic approach that the patient is coming with, Googling and self-diagnosing,
We get Google patients nowadays. Google
Yes.
patients.
Google patients. Google patients.
Yeah.
And very funny incident, I was an intern and I was in Mumbai back then. So एक female आती है, उसको knife से cut लग जाता है रात को. So I start suturing in my internship. So so this female, I still remember, ma'am, she had this Blackberry phone. Used to be there, and she was right there. She was like, what kind of suture is this? Is this a mattress suture? Is this suture? Is this, and what are you using? And this was my internship, ma'am. So then now I relate that conversation to this time. I think that was the very initial phase that I saw this happening, right? So these are the patients that everyone is dealing, every doctor is dealing now, where she has nothing to do with what kind of sutures I was taking and anything. But then you as a doctor are bound to answer now, because you are a service provider and she is the one who's going to pay you. Basically, it's a consumer relationship.
I think communication will solve this issue, because if we are able to explain to the patient, but that takes time. So the same thing, like because of less of time, so many patients, and again, communication may be the factor, as you said.
Right. And then the violence and the assault that doctors are going into, I think that is deteriorating also this relationship, because when we doctors are listening to n number of stories where this colleague of ours was beaten up, and they filed the case. There were mob attack. So in such circumstances, we want to play defensive. And when we play defensive, we may restrict ourselves and not be available to the patient as much as we could have, because of the probable litigation, violence, X number of things coming down. So that is also reason. And then probably the societal change, the patient's mindset, as I just discussed. I think these are the major factors every single day that I think all the doctors face, which is basically going to hamper the doctor-patient relationship and communication, and then patient satisfaction.
Yeah, I think communication is a core skill, and one must be able to communicate what he is going to do with the patient, because patients have some knowledge from Google, but this is maybe sometimes this is not quality knowledge. It may be wrong. So sometimes they have some preconceived ideas about the treatment. Then they compare that treatment with the treatment given by the doctor. And then something happens. They again start blaming the doctor that it was not explained to me. The sign was taken without information, all these things. And that's why the concept of informed consent, as nowadays we have started giving information and then take consent. Lizzie, I would like to ask, I think sometimes even if some trivial or some minor incident occurs in doctors or nursing home, media tries to inflate the incident, whatever happened in the hospital. Sometimes media also plays the role of deterioration in the doctor-patient relationship. Sometimes media is positive, some good, some honor given to doctor. They will try to give this news. But sometimes this news is on the back page or last page. But if something bad, some mishap occurs, that is given in magnified way on the front page. And I think sometimes this may make a difference in deterioration of the, as far as deterioration of the relationship concerned. What is your opinion? Role of media in this?
So, ma'am, I think media is in hands of everyone. I think, and that is the most scary part. Media, there was a time when media was available only with press people. But now I think everything is media because of social media. So whatever you say, your OPDs get recorded without your consents. The prescription people don't know the laws of privacy or anything. They post it. Then they misinformation, as you said. COVID time में हमने यही देखा है that ये आयुर्वेदिक treatment, ये इससे ये हो जाता है, उससे वो हो जाता है, और मार दिया ventilator पे. Remember those days, ma'am? When we have lost our colleagues. Doctors have lost their colleagues just because they were trying to save someone else's life. they had infected their families. But then how media posted is that you were the culprits who are making, you are not taking care of our patients. And so all that was going on. So social media is basically in hands of everyone. Now, hota kya hai ki, the worst part is that people are not giving in India, people are not truthful to their information that they are giving. Social media can be a very good thing, but the problem is that patients are not giving the right information to the public. और वो चाहते हैं कि एक बार आपके साथ आपका चाहे बिल ही ज्यादा आ गया, तो अब मैं क्या करूं कि मैं इस पेशेंट को, इस डॉक्टर को इतना बर्बाद कर दूं. सो जो वेंडेटा है, जो poisonous feelings हैं, that is why people are using social media for, and not to actually glorify any work that कभी मैंने ये किसी को ये गुणगान गाते नहीं सुना कि इस डॉक्टर के पास जा सकते हो अगर आप बीमार हो तो, क्योंकि इस डॉक्टर ने मेरा ये. I'm yet to hear that. And उसको उतना ही like आना चाहिए, उतना ही subscribe करना चाहिए. No one does that. Why? Because bad news, anything that opens your eyes, it looks probably more attractive to people. Somehow the negativity prevails like that.
Sale of the paper. Sale of the paper. Papers are sold like anything. If something is given that attracts attention. That's it.
Exactly. Similarly, there are people in our country who would propagate the wrong thoughts as if they're the right thoughts. And those are, they could be from any allopathic, Ayurvedic, and any this thing. I am not opposing the fact that you should not say what you want to say, but at least you should be truthful to the information that you have. You should have verified this information. Now this entire thing gets propagated, and suppose एक hospital के बारे में ही news है. Everyone in the park, in the community park, everyone, did you see that? Now this doctor's image, hospital's image is being destructed. So that is the effect of media to a person who has given his life to the entire profession. Those staff who has not gone home for probably 12 hours, 24 hours, they don't know that. All they care is कि मेरा patient है, मुझे सब कुछ चाहिए. But then again, as I said, corporate culture comes in. And then you are not bringing so there are corporate hospitals which don't want to pay the doctors more. So they think that we will go into rural areas, probably will earn better there, and so many factors in this. So media is in hands of everyone, and it is not being used as a good tool, and it's very saddening. But this is the reality of India right now, and it is bad for doctors. I'm yet to come to a point. We all are yet to come to a point where we can say the social media is for doctors. Not yet.
So it depends. It can be for the doctors. It can be against the doctor. It depends upon whether they verify whether it is a real scene. Just because somebody has told, they want to sell their paper and give something so that will attract the attention of the public. But many times it can be used for positive purpose also. We have seen good effects of media, but it depends upon how the media person is in touch with the medical profession or the particular doctor. How is the reputation of the doctor? What good things the doctor has done in the past, so that he will not immediately give the news. He will think twice before giving the news. But mostly at times it is used by patient just to malign the figure of the doctor, just to have a revengeful attitude that so much money has been taken, I would like to disturb the life of the doctor and all those things.
I would like to add one more thing, ma'am. What happens is, very surprisingly, and I think people who are here to listen to this would relate to this. अगर एक patient किसी चीज से ठीक हो गया, कोई एक particular treatment से ठीक हो गया, everyone in this thinking just because for say कोई भी ailment है और एक person ठीक होता है, वो social media पे डालता है कि मैं इस वजह से ठीक हुआ और जो भी X number things है. Now similar kind of symptoms वो कोई viewer देखता है, that person goes to this doctor and says that he got fine. Now you have to treat me like that. I should get fine because if he can get treated, I can get treated. So now just because they compare and they don't have any basis for that comparison, and it becomes a burden to that doctor who's treating this patient, who has come with this knowledge of foreknowledge of उसको ये नहीं पता कि उसके symptoms क्या थे, उसको depth नहीं पता उस illness की. So वो उस information के साथ जाएगा, now creating a burden and expectation, undue expectation from the doctor who has nothing to do with this entire scenario. So then this doctor will start treating in a defensive manner, that, oh, tomorrow he might create the problem. But then patient is not understanding that you have to trust this doctor. If you have gone to this doctor with whatever symptoms, you should have trusted this doctor. But no, he will trust that social media post more than this doctor.
Yeah. So it was said in the previously, we used to say that half of the treatment is with a smile, with a trust, and half of the treatment is actually required by the patient. But I think this half treatment is gone nowadays because of the loss of trust, because of the media influence, or because of some Googling, and why they don't have trust in the doctors. But they themselves come to doctor without having the proper trust. Then they start grumbling about anything if something happens. And Nidhi, you are advocate. I think there is also a role of lawyers. You can do certain things to improve the relationship, or at least decrease the number of litigations in the court of law, because already courts are very flooded rather with the cases against the doctors. So what is your role as an advocate, or role of advocate in preventing all these things?
So being a doctor turned into an advocate, I think I can pitch in at different levels here. One is preventive, ma'am, where I would say I can educate the doctors in the sense that that you should improve your communication. Then you should improve your conduct at the same time. Why standard of education, why documentation is important, why standard of care is important, and all those making them aware more about what exactly would happen once you go to the court of law to defend a particular case, and giving them examples what we face in the court of law, because that scenario is totally very different. What judge asks us is totally different what is being discussed among doctors at that point of time. Because when an actual case comes in, you have to make a wall with these bricks, and you have to bring those bricks together to create that wall. So at the same, so we all as doctors need to understand that how to have those bricks at least, so that I as a doctor can build that wall. So it is my duty to teach whatever I learn from my experience and knowledge, to teach this to doctors, that this is how we can go preventive about things. Not that we have to, and I very sincerely propagate that we should not fear litigation, not at all. You are good in what you do, and anyone can file a case against you. Like today, God forbid, but I can file a case against you also. Now you go to the court and keep defending it. Who's bothered? But that does not mean you did something bad to me. It's just that it's my whims and fancies. We came in contact. I can do very, very well that. So I shall do that. इसीलिए लोग कहते हैं कि वकीलों को as a patient लेने में लोग डरते हैं, डॉक्टर्स डरते हैं. मेरा तो पता नहीं अभी क्या ही होगा when I'll get old. मुझे नहीं लगता मुझे कोई ले रहा है. सोचेंगे तो medical legal lawyer है. But having said that, I'm sure.
Actually, we used to use term ambulance chaser advocate. Ambulance chaser advocates, because there are advocates are already ready. They just see whether the body is coming out or live patient is coming out. You used to think in that term, because so much of defensive practice. Because something happens, advocate is there to guide or misguide the patient. So that way we used to take negative aspect, but there are lawyers, there are advocates who can help. Like mediation is there, many arbitration clauses are there, so that they can be prevented to go into from going into court of law.
So doctors can, a medical legal expert advocate can be a mediator also, a very good mediator, where you can tell the pros and cons of going into litigation to both the parties, and probably bring them to settlement. Sometimes it's litigation is also merely a wastage of time, because you have your own lives and busy schedules and everything, and probably sometimes there is nothing coming out of this litigation. And if you explain this to the patient and both the parties, they might just want to settle and save this pain. At the same time, as एक और जो चीज मैंने इस प्रोफेशन में आके मुझे थोड़ा लगा है मैम, कि पेशेंट स्मार्टर है. डॉक्टर से कैसे इन दिस वन एस्पेक्ट. सो पेशेंट को पता है कि मेरे को न्यूरोलॉजिकल प्रॉब्लम है, तो वो जाएगा एक न्यूरो स्पेशलिस्ट के पास. उसको उसमें भी वो ये डिफरेंशिएट कर लेगा कि मुझे न्यूरोसर्जन के पास जाना है या न्यूरोलॉजिस्ट के पास जाना है. वेरी सैडली डॉक्टर्स के ऊपर लिटिगेशन होती है, डॉक्टर किसी लिटिगेशन में फंसता है, वो नहीं ढूंढते कि कौन मेडिको लीगल एक्सपर्ट है या कुछ नहीं है. सो दे वुड जस्ट से दैट ओ या हाँ एपेक्स प्रोवाइड कर रहा है, डॉकशील्ड प्रोवाइड कर रहा है या डॉकलैंड जो भी XYZ यू नो, सो हमारे पास इंडेमिनिटी है, उसी का लॉयर लेते हैं. अब सिंपल सी बात है, एक इंडेमिनिटी है, आप एक अच्छा लॉयर, अच्छा एक अच्छे डॉक्टर की फीस ज्यादा होती है बिकॉज उसको लगता है कि मेरा कैलिबर बहुत है, ठीक है. तो आपको क्या लगता है कि एक अच्छा लॉयर एपेक्स के साल के 10,000 रुपए में आ जाएगा आपके पास, जो आपकी पूरी जिंदगी की प्रैक्टिस को डिफेंड कर देगा. सो अगर हम इतने एजुकेटेड होके अगर हमें लगता है कि these companies will save our reputation, so then we are somewhere we need to think where we are going with this. Are we really trying to save our reputation or we are caring कि ठीक है compensation मांगेगा, indemnity भर देगी, जो उसके वकील को करना है. There are two thought processes. So so the advocates are there very less क्या मैम काउंट कर सकते हो आप हाथ पे की उंगलियों पे काउंट कर सकते हो कि कितने ही है. मेरे ख्याल से 2 या 3 हैं जो इस तरीके से डॉक्टर हैं और जो एडवोकेट्स हैं अपनी कंट्री में. सो उसके अलावा नहीं है कोई भी. तो ऐसा नहीं है कि वी आर नॉट अवेलेबल देयर, बट इट इज जस्ट दैट you as a doctor don't want to get out of that nutshell and say that let us hire someone who's an expert in that. But patients are smarter that way. They want to hire a specialist, get operated by a specialist with the maximum experience, and still be behind you to say that why didn't you provide me enough care, you know.
Yes.
So that is also one thing that I want to share on this platform. So I think we need to also be smarter on from whom we are taking advice.
Yes, because
that is very important.
That is foundation of the case. And again, expert lawyer in that particular fora, we have to select civil, consumer, depending upon the case, nature of the case. So all these, because they are going to save our life, not only life, our practice. Because otherwise, even if certain thing happens in a hospital, तो डॉक्टर का तो पूरा करियर डिस्टर्ब होने का ये रहता है, बाकी पेशेंट भी रहते. So twice they have to think which lawyer he or she should accept, or rather go for the lawyer, particular special, depending upon the specialty, like civil lawyer, criminal lawyer, consumer lawyer. And again, criminal cases nowadays, you know, because there are many criminal cases against doctor. So a civil lawyer cannot practice criminal cases against doctor. So it depends whether the fees are more or less, doesn't matter, but we have to select proper lawyer so that he or she can defend the case in the proper court. Otherwise, just selecting a lawyer has got no meaning. So we have to try all those means. Then only we can defend our practice, defend our case rather properly in front of the person who sits in the chair. Of course, the judge of the Supreme Court or High Court. Nidhi, I would like to ask again the same question a little bit. Present, you know, there is a corporate culture. People also want to go to hi-fi hospital, everything is ready. Just आवाज देने से सब कुछ हाथ में आता है. So these are the corporate culture nowadays going up, and patients also accept that because there are many reimbursement, etc., etc. So they accept. But do you think that because of this corporate culture, even patients and doctors, both sides, they don't come in direct contact with each other? Do you think that this is one of the reasons why the trust, the transparency, the communication skill has got a definite impact on the patient's opinion and patient's treatment? So do you think this is also important?
So, ma'am, first thing I want to say here is that, see, it is totally an individual's call. It is totally an individual doctor's call. How he wants to. I have met and I have been mentored even till today, and I'm very lucky that way. I've been mentored by doctors who are so loyal to their patients. They give time to the patients. They do not feel burdened by the corporate culture, sitting in a corporate, biggest corporates in the world. So even then, they are very true to their ethics. They're very true to their services that they are providing to the patient. But at the same time, yes, the burden, that the pressure that these hospitals are giving, the corporate hospitals, because they kind of set targets कि ओ आपने इतना revenue generate नहीं किया, So, let us think who can we bring in your place? And now this doctor sitting in his chair thinking, oh, I have worked so hard. Like this person would also do the same. So why can't I do? So let's just do that. Now you order extra tests, say, and, or make this patient stay longer in the hospital. So, and then why I'm saying all these words is that each thing needs to be justified to the patient. And if they are not satisfied, then you should not stop the patient. Send him Lama. Who's stopping you? But right now, when you are telling by somehow without any good reason, you're convincing the patient to stay, and then this patient sees the bill, he's gonna be mad about it. And this is again going to be, this is a problem of communication and lending into patient dissatisfaction and ruining the entire relationship. He's not going to give you another patient. He's not going to refer you. So this is a vicious cycle that we create and we don't know. But because we are sitting in corporate hospital, we are like, okay, fine. It is the job of the marketing company of this hospital to bring the patients. How do I care? I have to eventually, reach the target. So these are also the kind of doctors that probably we always discuss in our groups, that there are always black spots in any profession. So these could be those people also. But touch wood, in all these years, I am yet to meet some winner or be close to anyone who does such kind of a practice. But yes, I've heard these things around and not really experienced it. But this is also a true fact because, your colleagues tell you and things like that. So the administration also create a lot of pressure on the doctors, telling them to behave in a certain way, do things in a certain way. Then this expensive treatment of the corporate hospital. So government is free. So patient is anyway satisfied कि मेरा पैसा नहीं लग रहा है. But moment this financials come into the picture, everyone gets uncomfortable in corporate hospital. And corporate hospital would not even leave one penny unasked or unpaid. So now this is also a role of these corporate culture and corporate hospitals where this doctor-patient relationship get altered or get deteriorated and the gaps becomes, more and more. So I think this is how corporate would affect.
So one should introspect also while prescribing, while advising medicines and of course tests, whichever are essential, irrespective of the turnover. I think better go transparency, loyalty, and honesty, so that slowly even in corporate hospitals, because patients are going there definitely with good cause and they want some pleasure and relaxation as well. At the same time, they see the doctors are advising as per the requirement. The trust will be there and there will not be some untoward incidents if something happens in the hospital.
मुझे ये भी लगता है कि सॉरी टू इंटरप्ट, मुझे ये भी लगता है कि डॉक्टर्स को अपनी प्रैक्टिस, अपनी नॉलेज और अपनी कैपेबिलिटीज, एक्सपीरियंस पे इतना भरोसा होना चाहिए कि अगर कोई कॉर्पोरेट कल्चर आपको कुछ करने को बोल भी रहा है which you don't think is ethical or semi ethical, you should have that confidence as a doctor because you are the one who's running that hospital. The hospital cannot run on itself. So when you are the power, why can't you feel powered? Yes, a doctor should always feel powered.
Yes, we should be able to say no when it is not ethical or legal, and we should have power so that because of us the hospital is actually running, because of the confidence, because of the knowledge of that doctor. So the doctor must be powerful in his place. Then only this will not.
And I'll tell you an example of power. If you leave one hospital, your patients who are attached to you because you are an ethical person would go to that hospital where you are.
Yes.
So why do you need to do anything unethical? I really don't understand that fundamental.
Exactly.
And it is, and I apply this to my profession now as well. Like if you're honest to your clients and if you're providing what they need and they are satisfied, they will never leave your side.
Yes, they will come to you again wherever you go. So that's the secret behind all these things, so that people come to know that we should go to right person wherever you are there. Exactly. And this is lot of discussion was there regarding patients' rights, patients' duties. So just tell in short, what are the rights of the patients and of course duties of the patient? Because every right has a corresponding duty.
So since we are looking towards from the perspective of the doctors, so doctors are basically duty bound to provide standard of care. That is the what I say is the core crux. अब उस स्टैंडर्ड ऑफ केयर प्रोवाइड करने के अराउंड बहुत सारी चीजें हैं. So, for example, you are supposed to provide information to the best to the patient so that they can make an informed decision about the treatment options. So that is also your duty to give that knowledge to the patient. Secondly, you should act in the best competent manner that you can. All you cannot just lay back at one point of time, and because this is your duty towards the patient to be competent each time you see the patient. That is also a doctor's duty. And having said that this is a duty, you have to respect patient's autonomy. A patient is saying no means a no. You cannot unnecessarily do some procedure when patient is not ready for it, just because you think that would be the right, as we had already discussed this. Then if you think that you're not competent, or this is the matter or the treatment to be treated by some other doctor, you should not shy away from referring this patient to the because this patient is coming with a right to be treated to you. So now this patient should be referred to the right person as well, so that he can get treated in the right way. Secondly, you should also educate patient. Anything that you're doing in relation to the ailment that the patient is coming to you. You should only certify and say things what you are doing. Like suppose medical certificates. You should only sign those certificates which you think are being verified by you. You have seen the patient. You should just not randomly sign because someone else has seen the patient. Confidentiality. Confidentiality is very important. It is your duty to maintain that confidentiality because the patient has the right of privacy. And this has been discussed in different forums at different length. So we should maintain confidentiality of patient each time. Then emergency care. Every patient, if you have done MBBS, you are supposed to provide an emergency care. You should be competent enough to give that emergency care no matter what, because then it is your simple straightforward liability. No one can escape it. It is as simple as that. So this is also patient's right, that we as a doctors, we have to try our level best to save this person's life. So these duties are basically eventually the patient's right. Having said that, patient also has a duty to be loyal to your treatment, to be to honor what you are saying, to suppose आपने ट्रीटमेंट लिखा है तो वो घर जाके उसको फॉलो करे. फिर आपने अगर उसको फॉलो अप के लिए बुलाया है तो उसकी ड्यूटी है कि वो फॉलो अप के लिए आए आपके पास. So there are duties which patient needs to do. Respect the doctor. Do not be violent against them. Right? These are also patient's duty. Maintain the cleanliness and hygiene in the hospital. See, these also come in the perspective of the duties of the patient.
Yeah, I think these are because patients don't understand. They understand their rights only. They don't understand what are their duties. So they should also follow the advice and what you had discussed just now. Regarding a doctor's right, because doctor is also one independent entity. So doctors have also definite some rights and duties. So what are they? Just in short, doctors' rights.
Doctor's right is to have the right information from the patient, and this is also patient's duty to give the right information to the patient. So if the patient is only not giving you the right information, how are you going to treat the patient right? So this is the major right of a doctor. Second thing is remuneration and the fees. Doctors always say that we don't get paid well, right? Doctors, as my clients, say that, oh Nidhi, matlab now because I'm coming from the same fraternity, so they said, wow yaar, ye to bahut achhi cheez hai, vakilon ko to bahut acha paisa milta hai, doctors ko to nahi milta hai itna. And this has been discussed at length with my seniors who are doctors. So I was like, ma'am, मांगो. मैं तो कॉन्फ्रेंस में बोलती हूँ ये बातें कि आप मांगो, फीस देंगे. Now you have to value yourself. Gone are those days, as you said, where charity हो जाती थी. लोग कहते थे कि अच्छा नहीं है तो नहीं दे रहे, या है तो कम कर देते हैं. हम नहीं करते मैम किसी के लिए कम.
Yes. Yeah, there is
So
no bargaining. There is no bargaining.
there's no
Yeah.
bargaining. There's no need. You are entitled to your the knowledge that you are sharing, the time you are giving, the expertise that you have developed over years. You're entitled to it. So ask it. Then obviously whatever fees you're asking, you have to display. That is another thing. So those within setting things within those norms, you have the right to remuneration, which is these things are the day-to-day things that every doctor needs to feel that they're entitled to.
And I think except emergency, if the patient is like having grumbling, always grumbling, next time patient can be rejected by the doctor. This
Right.
doctor has right to refuse the patient unless it is an emergency. So
And-
he can say no to patient also.
बट मैम इसमें एक क्लॉज है, इसमें ये क्लॉज है कि आप तब अब या तो आपके पास एक वैलिड रीजन होना चाहिए. Suppose the
Yes.
patient is doing some badtamizi with you, you have a valid reason to say no to that patient. If that person is not following your instruction, you can say no to the you can say that I'm not going to treat you further because you're not listening to me. So even to say no to the patient, there are few norms.
Yes.
Because now the patient is say doing whatever you want to. Today you are saying that I am not going to see you, don't come, I don't like your face. So that is not going to be that should not be the reason. That's what I'm saying. So so we should be very careful while saying also no, because this also come with repercussions on having these patient being say not so good into the doctor patient relationship, not behaving so well in doctor patient relationship. We should also be mindful of how they are being rejected or how they are being refused for the treatment as well.
Yeah. Unless there's some valid reason, we should never refuse. Actually, in emergency only the clause applies. Otherwise, we can select the patient, but once selected, we cannot say no to patient just because you are not you are some going for picture or movie or something like. So emergency we have to treat, no doubt about that.
And if also the patient is not showing up for follow-ups. So suppose a patient, जैसे टेली कंसल्टेशन में एक रूल है, अगर आप आपकी फर्स्ट कंसल्टेशन सपोज मैं आज कंसल्ट कर रही हूँ, 6 महीने तक पेशेंट दोबारा कभी कंसल्ट नहीं करेगा, तो 6 महीने के बाद जो कंसल्टेशन होगा, that would be treated as the first consultation again. So now at that moment the doctor patient relationship was broken.
Yes.
So that is why this is treated as a first consultation. So then that is your prerogative. So you can say that, okay, now as this is the first consultation, and say you had a bad time with this patient, it was a difficult patient. Next time when he is coming for an appointment, you can say that, sorry, I'm not interested in treating you.
Yeah, because he has not followed the advice to come for follow-up, and disease has worsened now. And again, he or she has come after 6 months. Doctor can say it's not emergency. Last time you didn't come as per my follow-up guidelines. The disease has worsened now. So if something happens because the disease has worsened, again the doctor will be blamed. So in this case, if it's not emergency, doctor can definitely select the patient depending upon past experience, of course. And what you said correctly, there's some valid reason why you are saying no to the patient.
Also, we need to understand when this doctor-patient relationship starts. So once it starts, then you cannot say. So suppose, but you have not accepted the patient at the very inception of it, then it is not your patient at all. So then that is okay. But what we are discussing here is, I wanted to just clarify this point.
Yes.
So once you have accepted this patient, then you need a valid reason. But if say today someone walks in my clinic and I say that, sorry, I'm not going to see you, then that's okay, because this relationship was never established. So there is no point of even breaking it.
So it's a contract. Once the contract gets established, you cannot say no.
Be it implied and expressed or expressed.
Yes. Actually, this is the last question about to close this session. You were previously medical, means MBBS student, past MBBS, and then you turned to legal course rather. There is some, can you share one story, either in medical profession or in legal profession, that you like to share with us? Because we remember when we were MBBS students, we got some house job. That time we used to think we should have basic concept. If you elaborate on the basic concepts, it's very easy to get marks. But law, I have studied, we must have complete knowledge, thorough knowledge, and exact terms. Unless and until you use those terms, you don't get bonus marks. So that's true regarding legal education. So share one story if you like to, in any story in medical or.
So I'll share this story from the from the Court of Law, which is Supreme Court. So I was appearing in Supreme Court one time for a matter, and this was a matter from Southern India. So I would not be very specific about the details, just saying it. So I was appearing before a honorable judge in Supreme Court of India for this matter referred to me. This is I was fighting from the doctor's side, of course. This has come into appeal. NCDRC से Supreme Court में आया था matter. Then बात थी compensation कि the compensation, the patient wanted more compensation. What had happened in this case is the doctor, matlab my view does not matter here, but doctor was saying that I did not do anything wrong. Why should I pay more? And this patient was saying that I suffered, so I should be paid more. Now this patient flew down from Southern India to Supreme Court to attend that hearing. And she one of her hand was amputated, very sadly. So she, she had, covered her hand in a way that you could see that it is covered because there's some problem with it. Later, when the hearing started, she kind of showed her hand that it is amputated. So now we are talking about compensation and everything. So judge very empathetically said that, so she's not, she doesn't have a hand. So maybe we can think of giving some compensation on humanity grounds or something like that. So she said that, is this because of the doctor? Yeah, this thing. So she's like, no, that ma'am, this is an obs-gynae case that I'm fighting for. This has nothing to do with this amputation. So she said, no, ma'am. The patient also accepted. No, ma'am. This is because of some accident in train accident that I had lost this. So now the case is why we were standing there is because of
road traffic.
Yes. And now this lady is taking that empathy from the judge because now she doesn't have a hand for a different reason at the gap of 7 years. That accident happened at the gap of 7 years from the surgery that this surgeon had done. And now the honorable judge is expecting, to do some empathetic work and say that please see what you can do. And we had to settle that matter. And that day in court, I learned that it is not always about the game of law or the facts. It can be something random that you have not expected. I was thoroughly prepared in my brief. The judge had asked me a few questions. I had answered all of them. I was very strong in my case. So with this experience, I just want to tell all the doctors in the audience, whosoever goes to the court, that court is very unpredictable. All you can do is go try your best, and the rest no one knows. So have faith in your advocate and in God, and just do what the best you can do while doing any surgery, any kind of work that you are doing. And that would always be of your help. If you do wrong, then no one can save you. If the facts are not on your side, law will never be on your side. So that is my story, and that is what I learned from that courtroom. So
yes, thank you. It was very interesting to know, because when you are in one profession and you go to another profession, sometimes you think empathetically the previous person because you are already MBBS student. But sometimes the stories can give some take-home message to you for your further profession, I should say. That was a take-home message for you. And of course, there are many lawyers nowadays. Many gynec or many medicine people, they are learning law because they want to know basic law, knowledge about the basic laws that govern their practice. So that at the same time, they learn all these things about empathy, about the patient, what is the patient's rights and duties, the doctor's rights and duties. Because otherwise, we can't just treat the patient with just our medical knowledge. So knowledge of law and medicine together can make a magic as far as the prognosis of the practice is concerned, and as far as preventing the cases of litigation. So it was very wonderful meeting with you, Dr. Nidhi Yadav, advocate, I should say now, because there are two terms, prefix and suffix, we can attach to your name.
Yes.
thank you so much. And just one line from you for the doctors. One line for the doctors.
Please don't be scared to practice. Practice as if you own it, and I think you will do wonders. No one can put you behind bars. Don't be worried. Do the best that you can.
So thank you so much. Thank you so much for the wonderful message you have given to doctor. Don't get afraid of practicing. Don't have defensive practice. Practice with thorough knowledge and जैसे हम बोलते हैं ना जहाँ हम अच्छे से एयर या अच्छे से सांस ले सकते हैं इस टाइप के प्रैक्टिस करो जिससे पेशेंट का भी फायदा हो जाए. Not a defensive practice. Don't get afraid of the like court and advocates. They are always there to help you. Whenever you are transparent, honest in your practice. Of course, the lawyers like Dr. Nidhi Yadav are there who can help you.
Honesty is gonna win, ma'am. Honesty
Yeah.
is always gonna win. Hard work is always gonna win. It may take time, but you have to obviously choose the right advocate. Please
Yes.
don't choose the advocates who do not know the difference between acute and chronic.
Yes.
And if judge asks them, they are like, "Ye kya hota hai?" And this
Yes.
happens in consumer court. This is another one of my little story that judge has asked simple question like, "What is acute and chronic?" And the judge, the opposite
Advocate.
side counsel had no idea what acute or chronic was.
Oh.
Yeah. So please choose do not go into the courtroom without weapons. You do need weapons.
Weapons, yeah.
Yes. You need weapons for surgery. You need weapons to fight in the court of law. So do not just do these mistakes. And I think everyone in the in this field, they are wonderful people, ma'am. I always say this to advocate friends of mine that मैं तुम जैसी advocate कभी नहीं बन सकती क्योंकि मेरी परवरिश बहुत अच्छी हुई है. So I always say this, yes. So I think we all should be very proud of ourselves that we are good communicators. We are very good communicators. अगर आज मैं यहाँ बोल पा रही हूँ, it's just because कि मुझे patient के साथ मैंने सीखा है, बात करते करते सीखा है. So if I can do this, you can do this, and we all should be practicing with a lot of confidence.
Yeah. So thank you once again. Thank you so much
Thank
for
you,
sparing your
ma'am, for
valuable
giving
time for our Foxians. And all I learned many things from you. Especially, don't go for defensive practice and select proper lawyer who can help you in the court of law. So thank you so much. Thank you from Foxi, and thank you Evangel team, Rohit and Kripa and all for giving wonderful platform to all of us. Thank you. फिर से मिलेंगे.
Thank you so much.
Yes. Thank you so much.